TB is one of the major diseases caused by a bacteria that affects people, especially the nomad communities, due to ignorance. Statistics reveal that every year, out of 100,000 people, 250 are affected by TB, which is a major source of concern to the stakeholders. A non-governmental organization, JANNA Foundation, member of the Stop TB Partnership, is saddled with the responsibility to fight TB in Adamawa State and its communities. The NGO, having considered the vulnerable nature of nomads, pastoralists, now focusing on the communities and the nomad schools. To this end, modalities have been put in place to ensure that TB will be fight to its barest minimum.
One that is being targeted at this point in time are nomadic pastoralists. And most importantly, we are focusing on finding TB cases in nomadic schools and the communities around the schools. Volunteers have been selected from these areas, and we have already liaised with the organizations, appropriate organizations that deal with these schools. We've gotten a list of the organizations, and we've gone down to this particular local government areas to validate this list, and we already have a database on those schools that we are targeting.
The founder of the foundation, Dr. Stephen John, maintained that the training of community volunteers and nomad teachers is a step taken to fashion out strategies for an achievement. He reiterates that personnel who will visit the communities will be enlightened on the symptoms, transmission, treatment, and to get basic knowledge on TB infection.
Some of them are teachers of nomadic schools, and then a lot of them also are community volunteers from the nomadic communities. So these are the people we are training on being able to identify what we call presumptive TB cases from this target population, and then linking them to diagnosis, which is free, and provision of treatment, which is also free.
Dr. Stephen John maintained that the treatment of TB, which will last between 6 to 12 months, is free of charge, assuring that by the end of the 1 year, it is expected that the TB cases will be reduced drastically. Dr. Usman Michika, who is also a resource person at the training, described the project as timely, saying nomad settlements in the state have already been enlightened on the exercise. The session was interactive, as all the resource persons gave room for the community representatives to make their inputs and ask questions. Helamat Abanat, 26 News.